Ya Limadat, everyone. Welcome to the webinar today on Crohn's and Colitis. A Gutsy journey, a part of your health is your wealth series. We have some great panelists today who will give us information on Crohn's and Colitis and living with these chronic diseases. Before we start, we would like to thank all the volunteers who have worked so hard to develop this webinar. Land acknowledgement. I'd like to start with a land acknowledgement. We acknowledge the indigenous peoples of all the lands that we are situated on today. While we meet today on a virtual platform, we would like to take a moment to acknowledge the importance of these lands, the ancestral and unceded territory of all the Inuit, Métis, and First Nations people all across Canada that call this nation home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. My name is Sadaf Hashimi, and I'm located in Northeast Toronto. I serve on the National Health Promotion Team, and I'm currently working on obtaining a diploma in practical nursing at Seneca College. I work as a support worker at Cost Immigrant Services, where I assist immigrants in their settlement and integration process. I'm excited to be moderating today's presentation and look forward to learning more about Crohn's and ulcerative colitis and understanding the management of these chronic diseases. I will be joined by two experts, Dr. Farhad Peerani and Dr. Puneeta Tandon, as well as Shafeen Rajani, who will share his experience living with ulcerative colitis. The objectives of today's webinar are to provide an overview of Crohn's disease and ulcerative colitis, including strategies to empower and improve the quality of life of people living with the disease. Provide practical tips for living with Crohn's disease and ulcerative colitis. Share a personal journey of living with ulcerative colitis. Before we get started, we would like the audience to know that any information provided in this webinar should not be considered medical advice, and it is not intended as a substitute for medical professional help, advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding your medical care. Now, it is my pleasure to introduce Dr. Farhad Peerani. Dr. Peerani graduated from the University of British Columbia's medical program and completed residencies in internal medicine and gastroenterology at the University of Alberta. He pursued a 2-year clinical research inflammatory bowel disease fellowship at both the University of Alberta and Mount Sinai Hospital in New York City. He is currently an assistant professor of medicine at the University of Alberta and devotes the majority of his time to treating patients with Crohn's and colitis. In November 2023, he was awarded Physician of the Year by Crohn's and Colitis Canada. Please join me in welcoming Dr. Peerani.
Thank you, Sadaf, for that very kind introduction. Yalimadad, everyone. I'm Farhad Peerani, as you've heard, and I'm very honored today to speak to you guys about a topic that's very near and dear to my heart and my patient population, and that's Crohn's disease and ulcerative colitis. Today's mini journey, I will take you through how common the disease is, what triggers the disease, what are common symptoms, how to diagnose it, some medical therapy options, why it's important to treat the disease, as well as how the diet and the microbiome are implicated in inflammatory bowel disease. So how common are Crohn's and colitis? When we ask this question, there are two important terms to understand. One is incidence, and that refers to the number of new diagnoses of Crohn's disease and ulcerative colitis, as well as prevalence, which refers to the number of people living with the disease. This graphical depiction shows the incidence of pediatric IBD across the world. And IBD is most prevalent in North America and Western Europe. And the incidence of pediatric IBD is increasing across the globe. And when you look at all patients, not just pediatric, but also adult patients with IBD, you see similar trends in terms of where the disease is most prevalent. If you take Canada alone, in 2023, roughly 320,000 individuals live with Crohn's disease and ulcerative colitis, and an estimated 11,000 new diagnoses will occur in 2023. So as you can see, this is a chronic disease that affects a large majority of patients here in Canada. So what causes the disease? It's a combination of factors. Often there's a genetic susceptibility, and how one's own immune system interacts with both environmental triggers as well as microbial antigens. There are many genes that have been implicated in the onset of ulcerative colitis and Crohn's disease, and twin studies have demonstrated that there is a greater genetic predisposition to Crohn's disease versus ulcerative colitis. Now, if one parent is affected, the risk of an offspring being affected is up to 5%. And if both parents are affected, the risk of offspring being affected is up to 30%. Now, genetics aren't the entire story, and we talked about environmental triggers, and there are many, many environmental triggers at play, including breastfeeding, including mode of delivery, including socioeconomic factors, psychological state, which my colleague Dr. Tandon will touch upon in this webinar as well. Smoking, in addition, has been noted to have a detrimental effect on Crohn's disease patients, and somewhat of a mildly protective effect, interestingly enough, in ulcerative colitis patients. Now, having said that, by no means do we recommend that our ulcerative colitis patients smoke cigarettes, as the benefits are far outweighed by the risks. So what are the signs and symptoms of Crohn's disease and ulcerative colitis? Now, while there may be some overlap, here I've tried to summarize some of the take-home points. In Crohn's disease patients, the symptoms can often be insidious in nature and sometimes can be mistaken for a diagnosis such as irritable bowel syndrome. So Crohn's disease patients can have abdominal pain, typically non-bloody diarrhea and weight loss, whereas the hallmark of ulcerative colitis is bloody diarrhea. Crohn's disease can affect anywhere we say from gum to bum, whereas ulcerative colitis is particularly affecting the colon or large intestine. Crohn's disease can affect various parts along the gastrointestinal tract in skip areas, whereas ulcerative colitis typically starts at the rectum, which is the bottom of the colon, and the inflammation works its way upwards around the colon. In terms of inflammation in Crohn's disease, it is transmural. What that means is that the inflammation typically affects the entire wall of the bowel, and that can result in complications of disease known as strictures or narrowings in the bowel, and fistulas, which are abnormal connections between either one piece of bowel and another, or one piece of bowel and an organ or the skin. Ulcerative colitis typically is thought to have a more superficial level of inflammation. And lastly, extraintestinal manifestations are more common in Crohn's disease than they are in ulcerative colitis. So you may be asking yourself, what are extraintestinal manifestations of IBD? They can come in many, many forms, and some of the pictures here depict some of these extraintestinal manifestations. So in the top left picture A, people can have intestinal ulceration, and similarly, they can have oral cavity ulceration or aphthous ulcers. In the middle picture, this is an individual with red, painful nodules on their lower shins, consistent with erythema nodosum. And finally, on the far right, the redness of the sclera of the eye in this setting is known as episcleritis. So if patients present with some of these other symptoms, one should be astute enough to think about associations with IBD. Colonoscopy is the gold standard for diagnosis with biopsies of the affected tissue. And this diagnosis can only be made after you've ruled out that people have been off of non-steroidal anti-inflammatory use. So that means that they're not using chronic Advil or Aleve, and infection has been ruled out. Other supporting evidence includes symptoms, blood work looking at micronutrients such as iron and vitamin B12, looking if a patient is anemic as reflected by their hemoglobin, and looking at an inflammatory marker called C-reactive protein, which can be elevated in some IBD patients. Fecal calprotectin is a stool test that is non-invasive, and it offers us a glimpse into the bowel. If it is abnormal, it means that there is inflammation in the bowel. However, it doesn't necessarily mean that you have Crohn's disease or ulcerative colitis. It just means that something is abnormal. And lastly, imaging. There are various different modalities that are being used: CT, MRI, and more recently, bowel ultrasound. There are many, many medical therapies out there in this day and age. In the past, prednisone or steroids were the mainstay of treatment, along with 5-aminosalicylic acid medications such as Salifalk and Asacol, in addition to immunomodulators such as Imuran and methotrexate. Now, infliximab or Remicade was the first biologic that completely revolutionized the treatment of inflammatory bowel disease. And this therapy has subsequently been followed by other biologic therapies and small molecule therapies, which target various aspects of the immune system. Now, it's important to understand that while these therapies can have some rare side effects associated with them, I often will explain to my patients the risks of not treating disease effectively. And some of those risks involve infection, as well as, if you take this into account, that depending on where people get emergency surgery done for their Crohn's disease or ulcerative colitis, the chance of dying after a surgery can be as high as 3 to 5%. So in medicine, we're always weighing the risks and benefits of therapy. Now, I will only speak directly to medical therapies in this slide, but it is of utmost importance that we do consider the whole individual and looking at mental health, mental wellness, which again, Dr. Tandon addresses in this webinar. So why is it important to treat the disease? Well, first and foremost, as a provider, I want to ensure that you as a patient have and enjoy a good quality of life. And I will say that the majority of IBD patients that I treat do maintain a good quality of life. Secondly, we want to prevent complications of disease. Evidence has shown that if you treat Crohn's disease effectively within 2 years of diagnosis, you can alter how the disease will act over a patient's lifetime. And what complications are we trying to prevent? Well, that includes those strictures or narrowings, fistulas or abnormal connections, abscesses, which are pockets of infection. And these complications can result in surgeries, and not sometimes just one surgery, but sometimes patients require recurrent surgeries. And lastly, we want to prevent colon cancer. Inflammation in the colon over longer periods of time predispose a patient to polyp development and eventually colon cancer risks. Now, this data, quoting a cumulative risk of 5% of colon cancer after you've had the disease for over 2 decades, comes from some older data. Nowadays, we're much more proactive in controlling inflammation and monitoring for inflammation. And so that risk is likely decreased. Nevertheless, as of now, we do enroll patients in a screening program, doing colonoscopies regularly every 1, 3, or 5 years to screen for colon cancer and polyps, depending on various risk factors the patient has. Now, what is the role of the microbiome? And for those of you who aren't familiar with the term, the microbiome reflects the microorganisms in our intestine, including bacteria, viruses, and fungi. And believe it or not, the majority of cells in our body and the majority of genes in our body are made up by bacteria and fungi and virus. When you look at the microbiome in a state of health, there are many abundant, healthy bacteria, and this remains stable over time. When you get into a state of disease, the number of healthy bacteria decrease, you get an abundance of pro-inflammatory bacteria, and the composition of the gut bacteria is unstable over time. So how do our microbiome, or how do the microbiomes change in our bodies? Diet, sanitation, antibiotics, mode of delivery, many factors play a role. But I want to focus on diet here in the next slide. There are many, many diets out there that have been discussed in our patients who suffer from Crohn's disease and ulcerative colitis, and those include, amongst many others, the specific carbohydrate diet, gluten-free diet, the Crohn's disease exclusionary diet, as well as the Mediterranean diet. Overall, I think big themes are to avoid a lot of, red meat, avoid a lot of fatty foods, processed foods, and overall, fiber is beneficial, and there are some nuances to that discussion. So how can we manipulate the microbiome to our benefit for our IBD patients? Well, number one, we can try to feed it with the use of specific diets and prebiotics. Number two, change it. Change it with probiotics and even antibiotics. And number three, we can try swapping it with fecal microbial transplantation. Basically, what that is taking stool samples from a healthy patient or healthy donor and transplanting it into a patient, in this case, with inflammatory bowel disease, to see if the good or healthy bacteria can repopulate in that individual and mitigate or decrease the amount of inflammation. These here are my website references for the images I've used. I thank you again for taking the time to view this webinar. Sadaf, back to you.
Thank you, Dr. Peerani, for your very informative presentation. I would like to introduce our next speaker, Dr. Puneeta Tandon. Dr. Puneeta Tandon has been a transplant hepatologist and faculty member at the University of Alberta since 2007. She is a certified yoga teacher, health coach, and active researcher who is driven by the desire to empower people living with chronic conditions with practical tools for improving knowledge and their physical and mental well-being. Over to you, Dr. Tandon.
Thank you very much for the invitation to present today, Farhad. That was an excellent presentation. And in this presentation, I'm looking forward to sharing with you some practical science-based strategies to bring well-being into your life. As a disclosure, I'm the lead investigator of a study that I mentioned in this set of slides called the Empower study. Dr. Peerani is also a part of this, and it is funded by the Canadian Institutes of Health Research. Neither of us have any financial conflicts or conflicts of interest with the Empower study materials that I'll be discussing in this presentation. So this is why we're here. All of us, I would say, want to feel more well-being. Well-being has many, many domains, as you can imagine, including our psychological health, our social health, our relationships, our occupational health if we're still working, our finances, and of course, our physical health. And in individuals who have chronic conditions such as inflammatory bowel disease, we know that mental distress is more common. So at the tip of the iceberg, conditions like clinically diagnosed depression or anxiety are 2 to 3-fold more common than in the general population. But that is just the tip of the iceberg. Many more people have what we call chronic disease distress. And that relates to the fact that there is distress related to uncertainty around the chronic condition, or having to change your routine, having to change your relationships, having to deal with the mental and the physical stress that comes. And this cannot be ignored. What is it like to live with IBD? For those of you in the audience who have Crohn's or have colitis, you will know better than I what it is to live with this condition. And we have the pleasure of hearing after myself from a patient partner who will tell us about his lived experience. These are a few quotes that Dr. Peerani and I have had the opportunity to get from interviews that we've done with patients. Just to give you an example, so for this patient, I feel like it takes up a large part of my life, time-wise. I call it the social barrier disease. Another patient saying that they felt like it was a chronic illness that was invisible. Another patient expressing difficulties talking about their condition with people. And another one saying that they had a lot of stress, that they know that stress was a factor for their Crohn's symptoms. And perhaps many of you can relate to this. It's certainly about 60 to 70% of individuals living with Crohn's or colitis do feel that stress is a factor in their disease. So with all of that, why do we have stress? What is the point of having stress? And I'm going to introduce the concept of acute stress, and then we'll talk about chronic stress. So let's start with acute stress. And I'm going to show you a short video. This is a clip of me jumping out of a plane on a skydive. So during this decision, I was absolutely lucky and glad that my acute stress response fired up. It was very necessary. And that's because my sympathetic nervous system needed to be on. My fight or flight response was getting my body and my brain ready for action. So kinds of things that show up with this, my mouth would be dry. I don't need my saliva production at that time. My muscles are tensing up. My heart's pumping faster. My breathing is fast and shallow. And there's a lot of release of stress hormones, adrenaline, inflammatory cytokines. How many of you can relate to feeling these symptoms of acute stress? Everyone. The challenge, though, is when we feel these symptoms chronically. And what we're doing during our days is we're skydiving now multiple times a day. So we're activating this acute stress response when we're stressed about a medical appointment, when we're stressed about being stuck in traffic, when we have an argument with a loved one. And that is called chronic stress. So what does that do? Alarm bells ring in the survival brain. And what it does is it also drains our emotional battery. Another way of looking at chronic stress, this is a definition from the American Psychological Association, is emotional and physiological reactions that happen in situations where demands exceed our ability to cope. So I've mentioned, and you know, that there are so many demands on all of us, including having a chronic condition like inflammatory bowel disease. And I would say that there are many things that we can do to try and reduce these demands and optimize it, including taking our medications if we do have Crohn's or colitis, for example. But we will always have demands. And what we're going to learn coming up next is how do we also at the same time increase our ability to cope. So to understand this, before we get into what the strategies are, I need us to understand the mind-body connection. Sometimes we can think of the mind and body as being separate, but they are very, very interconnected. And I'm just going to give you 3 examples of that. So with inflammatory bowel disease, these connections called the brain-gut interaction have been known about for a long time. This is a review article now that's 10 years old that's going into these theories. So here we know, for example, that the microbiome that Dr. Peerani spoke about, the gut microbiome can actually link up and affect our mood and affect stress, how we feel. Similarly, stress can go down and actually cause changes in the gut itself. So it can increase the leakiness of the gut. That's called increasing intestinal permeability. It can change the way the gut moves. All of us will know about having more diarrhea episodes when we're feeling stressed. It can also reduce the immune function or change the immune system of the gut. So this bidirectional two-way relationship with the brain and the gut is very, very prevalent in IBD. Another example, this is an example of how emotions can have an impact on our physical organs. So looking at the effects of anger on how the heart pumps. It's called left ventricular ejection fraction in individuals with heart disease. So what they did is they asked individuals to remember an episode that had caused them to become really, really angry. They had an ultrasound or an echocardiogram on their chest, measuring their heart function at that time when they were remembering that episode. 4 out of 10 of those individuals had a significant reduction in the ability of their heart to pump. Their anger, their emotion, was causing an impact on their heart. This is another study looking at emotions and the immune response. So 334 adult volunteers in this study were given questionnaires to determine were they more positive emotional style or negative emotional style in the way that they approached things and how they thought about life. Then all of them had the virus that causes the common cold dripped into their nose. It's called the rhinovirus. And with that, how many of them actually developed a cold was the question. And how did positive emotional style impact it? And you can see positive emotional style is in the white if it's high. Those individuals with high positive emotional style had a less chance of getting colds, whether it was measured objectively or subjectively. Again, better immune response. And all of this, as well as our patient partners coming to us and saying we need to have something that we can add to our medications to help our overall health, led Dr. Peerani and I now a few years back to develop a stress reduction intervention program that was delivered online and to evaluate this in research. And these are the publications that came out about that. And since then, we've gone on to do several more studies as well. So just to share some of those results, really high-level results from the initial randomized trial, it included 101 individuals, mean age of 43 years, half and half ulcerative colitis and Crohn's disease. And with the 12-week program, what we found that there was a significant reduction in depression-related symptoms, anxiety, and stress, as well as significant improvements in quality of life. We had a lot of participant feedback. We interviewed almost all of the individuals who had participated in the study, so this is just a small number of quotes. But things like the participants acknowledging that they were grateful that it was a study that looked at the whole person as opposed to just looking at the disease as a physical thing. With the benefits in this individual saying actually radiating out from them to impacting how they treated people around them. This other individual noticed more energy. Another individual really liked the breathwork practices, knowing that they could use them as a tool to reduce that acute stress response. Evening meditations helping this individual to sleep, and then overall feeling that they were empowered, strengthened, and balanced. And so these were just a few, again, of the many comments that were received. And that led us to, again, acknowledge that individuals are looking for more of these science-based wellness practices. And this is the study that I mentioned at the beginning called the Empower Study. The Empower Study has 2 main aims. One is to teach individuals techniques to reduce the acute stress response and its effects. And so you're reducing that survival brain firing up when it's not needed. And secondly, to teach strategies to allow us to really charge up our brains, our higher level brain functions that are responsible for regulating emotions and self-awareness. So I want to show you some strategies for how this is done. The program includes multiple techniques, and all of these I'm bringing up because they are science-based, and so you can do them, obviously, even outside of the Empower program. Things like mindful movement, breathing practices, meditations, and sleep practices were highlighted. Psychology-based programming is really key, and this is obviously using the mind to impact the mind, to change our thoughts. Disease education is essential, So everyone should be reaching out to their doctors for more information about your condition. You should not be shy about doing that. It is your right to get education. Within the program itself, we include, at the request of our patients, every week a tip about inflammatory bowel disease. In this particular week, I've got one up about the connection between diet and inflammation, for example. And then the other thing is building a community. So community support, everyone on this webinar is so lucky to have the community that you have to support yourselves. And this program also acknowledges that when you're doing any of these wellness practices, it's easier to do them when you're doing them with someone else. What are the kinds of things that you can look at that are science-based practices in the literature? Things like building a routine, things like knowing what your values are, how do you set goals, pacing, which I'll briefly talk about, managing thoughts, managing feelings, self-compassion, being kind to ourselves. All of these things have a lot of scientific papers to back them. In the program, there's a whole week on sleep. There's a week on how do you build a community, gratitude, which I'll show you a study about. And a lot of this is based on a psychological theory called acceptance and commitment therapy, which allows you to really figure out what is important to you and how do you choose to live a life that's based on your values. So values, very important, and there are certainly programs and things that you can find on the internet to help you discover what your values are. And I would suggest this is an important thing to be able to know what decisions you want to make in your life. So in the program itself, we have a little game that allows you to do this. The other really key thing I would suggest to everyone who's struggling maybe with low energy is being deliberate about thinking about what are you draining and spending your battery on during the day? How does stress actually drain your battery? What are you doing about charging your battery? Do you have any kinds of practices? And really noticing this can help us, again, to decide what we want to spend our time on every day. Gratitude is incredibly powerful. I've just put up one study here. This is a study looking at the neural mechanisms. So what's happening in the brain when we're actually being grateful. And what they did is they took women and randomized them to doing a gratitude practice or not doing a gratitude practice. Look at how short it was. It was just 5 to 10 minutes a week for 6 weeks. What happened after that 6 weeks? The people who were practicing gratitude had less activation of the amygdala, which is a little peanut-sized area in the brain that is responsible for us feeling fear. Okay, so less activation of the amygdala and less activation of inflammation in their bodies. All of that from 5 to 10 minutes a week for 6 weeks of a gratitude practice. So if you're practicing gratitude, just a couple of tips. Really, you can write it down as these individuals did in this study. You can journal it or you can think of it, but it must come with emotion. You have to really feel the emotion around gratitude. That leads to the most benefits. What about some other practices that I've pointed out that we've included in the program that are science-based? Movement. I haven't spoken about exercise. Classic exercise is also absolutely essential. Exercise helps us to feel better. It helps our bodies to be stronger. Here I've put up studies that focus on what we call mindful movement, and that's what we've included in the program itself, things like yoga and Tai Chi, as well as some basic chair movement exercises. Hundreds, thousands of studies actually showing benefit. These studies looking at yoga reducing stress and exhaustion, yoga changing inflammation, improving immune system function. And this study at the bottom here looking at Tai Chi and what it does to the brain size. So as we get older, our brains will start to shrink. Practices like Tai Chi and yoga can help your brain to actually stay, not shrink as much and stay larger. And that helps obviously with our ability to process and think and make complex decisions. This study I found very interesting, and I'll just ask you to think about how are you sitting at the moment? Are you sitting with good posture? Are you sitting a little bit collapsed? And these investigators looked at how that might actually change your emotions. So again, your body changing your mind and how you feel. So what they did is they got students to either sit in a collapsed pose or in an erect pose where their posture was good. And they got to think about negative memories and positive memories when they were sitting in those states. And what the students reported is that it was so much more difficult to think of negative memories when they were actually sitting upright. It was so much easier to do so when they were sitting collapsed. This is something you can do in a moment. And this is something that movement practices help you to do as you strengthen your core. Breath work is another thing, again, that is very little known about, but very, very powerful. And I would encourage you to look this up for more information if you're interested. The breath work that we've included in the program spans from belly breathing, breathing with sighs, being aware of your breath at the nostrils, and something called bee breath. We go into other practices as well, but all of these practices do is, instead of activating that sympathetic nervous system that I activated when I was jumping out of the plane, they activate the opposite side of the nervous system called the parasympathetic nervous system. And that's the rest and relax phase. Within less than a minute of doing breathwork practice, you can activate your parasympathetic nervous system. The easiest way, if you're feeling stressed, is to sigh. So you're taking a deep breath in with your nose and a long exhalation. Anytime you're breathing out longer than you're breathing in, you're stimulating the parasympathetic nervous system. You do that 3 times, you will notice that you are relaxed. Similarly, belly breathing, what it does is it activates the parasympathetic nervous system by activating the vagus nerve, which runs right through the big breathing muscle called the diaphragm. That's between your lungs and your belly. So these kinds of practices, again, can be used acutely and chronically to help with stress. What about meditation? Meditation has gotten a lot of press, and for good reason. There's lots of studies to support its benefits. It can cause changes in brain structure. So similar to what we saw with Tai Chi, not allowing the brain to shrink as much, meditation, again, can increase the volume of the brain in areas that we want it to increase, areas focused on attention and working memory. It can also decrease the size of the brain in that same fear center, the amygdala. That's after 8 weeks of a regular practice. You can start to see changes. It also changes brain function. So it improves focus and memory. It decreases how much your mind wanders when you're trying to focus on a task. It improves emotional regulation. So you don't get as angry, you don't get as sad, you're able to regulate. It increases the connection as well between different brain regions, which allows us to make more complex decisions more easily. Sleep practices, a lot of them focus on meditation. And if you're interested, you can look up things like Yoga Nidra, spelled Y-O-G-A, Nidra, N-I-D-R-A. That practice is very helpful as a non-sleep deep rest practice that has a lot of benefit for reducing stress hormones and improving quality of sleep. A few studies just to show you that it doesn't take a lot of time. This is brief daily meditation. This was a study done out of Stanford, I believe. 13 minutes every day for 8 weeks, and they saw significant improvements in attention, memory, mood, and emotional regulation in people who had never meditated before. There's many studies showing improvements in memory, reorganizing brain networks, improving how well you think, and improving attention. So again, this is just a few of the many. My last science slide is another very interesting one. This is looking at the impact on telomeres. And telomeres are these little caps that are on the tops of our chromosomes. And our chromosomes obviously host our DNA. So as we age, our telomeres, our little caps that protect our chromosomes, get smaller and smaller. That also happens when we have stressful events in our life. And the size of your telomeres are related to how long you live. So what they did in this study is they looked at individuals who were undergoing breast cancer treatment. They gave them a meditation routine, or the others, they didn't. And they saw what happened to the telomeres of these ladies. The telomeres shrunk a lot less in those individuals who were meditating throughout their treatment. So very, very interesting physiological responses. Okay, with that, I hope that I've been able to express that depression, anxiety, chronic stress, and disease distress are really all too common in individuals living with inflammatory bowel disease. And our patients have told us, and we have data to show that they absolutely negatively impact health and well-being. There are many, many things that you can do to empower yourself with science-based strategies, and it only takes 5 to 10 minutes a day. You can find a lot of information online about a lot of what I've talked about. There's excellent resources. I'm very impressed with the 5 to Thrive that the Aga Khan Health Board has put out, which speaks to a lot of these practices as well. And then Dr. Peerani and I would, of course, be thrilled for you to join the Empower study as well, which is available to anyone in North America. Just a couple more details about how you might join Empower if you are interested. It requires access to the internet and a smart device. You can have inflammatory bowel disease, or it's open to individuals with other chronic health conditions. It might be for you if you want to learn these techniques to improve your stress and you want to contribute to research. And these are the QR codes that you can scan to register, and you can email anytime if you'd like at empower@ualberta.ca for questions. With that, I want to acknowledge, again, the team. Thank you for inviting me to do this, and the team that I work with of students and other researchers and patients, of course, and my family for allowing me to work on this. Thank you so much, everybody.
Thank you, Dr. Tandon, very much for all the information on the health effects of chronic disease and strategies for greater well-being. It is now my pleasure to introduce our next speaker, Shafeen Rajani, who has kindly agreed to share with us his experience in living with ulcerative colitis. Welcome, Shafeen.
Hi, Sadaf. Thank you for having me and being able to share my journey with you guys.
Shafeen, we would love to hear about your health journey. Could you tell us a bit more about your diagnosis? What symptoms did you experience?
All right. Well, I can start by saying that I am an ulcerative colitis survivor. The best way I can explain my symptoms I experienced are in 3 stages of my journey. Stage 1 spanned over 13 years. A little background info about me is that I was working full-time in retail while I was studying part-time. The initial symptoms had manifested or that I noticed in February of 2001, preparing for my college midterm exams. I observed blood residue around my stool. There was an increase of frequency going to the toilet 3 to 4 times a day, irregular bowel movements, and diarrhea. This continued on for about a week, and then I was back to normal. I had brought this attention to my GP, and in turn, she had introduced me to a GI specialist. Now, those days, healthcare access took some time. I had to wait for a couple of months before I saw my GI specialist. He investigated through a series of health questions, inquired about my family health history, which I had no knowledge of anyone having any bowel issues. And then he performed a sigmoidoscopy shortly after. And ideally, then I was categorized as IBS. We discussed a regimen of medication I would take when I would have my next flare-up. So I treated this as almost like a viral infection that I had medication to take. So I didn't think too much of it. I pretty much didn't change any of my lifestyle. I just knew that if I had another flare-up, I would take some medication. For the next 2 years, I had 2 more episodes that was quite similar to my first one. It seemed each time the episode was happening around my high stressful situations, around exams or around work stress. I followed the medication plan that I was given, oral anti-inflammatories, for a short period of time. Unfortunately, my condition worsened in February 2003. Again, I'm writing some midterm exams, and I noticed some severe abdominal pain and constant cramping. I had bloody stool, flushing of fluids this time, and basically a pool of blood in the toilet. My frequency to the toilet now almost doubled, around 6 to 7 times a day, and lasted a little over a week. Once again, I made an appointment with my GI. This time we rushed for a colonoscopy procedure. The results came back and I was diagnosed with ulcerative colitis. I was reassured maintaining a medication plan and making some changes to my nutrition, I should be okay. So for the next 10 years, I tried eating a little bit healthier, nothing too drastic changes into my lifestyle, maintained my medication plan. So the changes in my medication plan were increased dosage of the anti-inflammatory, and then we also added suppository, and later on we added some steroids such as prednisone. This was due mostly to the symptoms that were lingering longer, minus the bleeding at times. I started to gain weight and I felt very insecure of my physical self. Additional common symptoms that I was going through was random gurgling noises from my intestines, severe urges to go to the toilet, but very little output to no output. In addition, I started to notice boils on my body. 2 times the boils were severe and near my anus, abscess and blood accumulating in the size of a golf ball. I had to go into emergency to get the boil lanced and drained both times. This was an extremely uncomfortable situation and quite painful. It also put me bedridden for at least 3 to 4 days, missing out work and also family time. Later on in my journey, I was hospitalized in April 2013. I was constantly bleeding for 8 weeks because I ended up deciding to self-medicate myself with the regimens that I was given, and I continued to follow. I also noticed that the bleeding wouldn't stop. So when I did get hospitalized at that time, I was told that I needed to do the surgery, which I wasn't prepared for. Fortunately for me, I also had a viral infection that needed to be treated first. During that treatment, my colitis flare-up started to get under control, and then was given the option to either proceed with the surgery or delay it. I chose to delay it because I was quite afraid on how this would affect my life. I soon realized that this disease had full control over my life, and I needed to start regaining that control by doing my own research and start questioning what was going on and start challenging my GI if there was any options. My condition continued to get severe. I was now going to the toilet anywhere from 7 to 10 times a day. I was having disruption of sleep anywhere from 2 to 4 times within a 7-hour period of time. I was physically and mentally exhausted, and this put a toll on my work life, my social life, and my family life. In addition, I was manifesting additional symptoms such as heel spurs, inflammation in my ankle, and also my knee. That would also put me out and bedridden because I couldn't put any pressure on my legs. At times when I would have to go to the toilet, I'd be crawling. Currently, I'm still on meds to control my gout by arthritis. Also with the mental stress, I was losing a lot of my patience and focus, and that put a strain with my family because anything that would happen that wasn't positive in my environment, that would trigger me and I would get quite upset. So those were pretty much all the symptoms that I had experienced from my stage 1. Stage 2 was a transition where I was forced to go through the surgery, but this time I was a little bit more informed and accepted the fact that the surgery needed to happen. Thank you, Sadaf.
Thanks for sharing your experience. That was quite a long journey for you. What changes have you made to support your health?
So during my journey, I realized that I had to identify my triggers. One was that I was getting lack of sleep. I wasn't getting proper rest, especially with the interrupted sleeping. So I knew that I had to somehow get proper rest, and also gravitated to some meditation. I also started to log a food journal, realized that few of the triggers that commonly are associated with colitis, by eating excessive red meat. And one of my vices was that I would consume a lot of sugar products and drink carbonated drinks. So those were things that I needed to start controlling. I also noticed that raw vegetables would trigger me right away, and spicy foods, which in our culture or whatever is quite common. Another odd thing that I noticed that would trigger my my colitis was the change in temperature. When times would get cold, I would get severe cramping. My stomach would knot up to a point where I would immediately have to rush to the toilet. And again, I'd be sitting in the toilet for a good 10, 15 minutes where there was no output at all. Some of the hacks I learned when I had identified some of the triggers was that I was drinking hot water. I had a heating pad with me almost all the time, or I would turn on the heating seat while I'd be driving. That would give me comfort. I also realized that with frequent toilet times, anywhere from like 7 to 10 times, actually it peaked all the way up to 16 times a day, that I was flushing a lot of fluid. So I had to rehydrate myself. Unfortunately, I'm not a fan of water. I drank a lot of Gatorade Zero to reduce the sugar, but also rehydration. I also then learned that because I didn't like water, I added some squirts just to maintain my hydration. Also, I started to teach myself and learned that I can start making myself smoothies, yogurt base, and introduced probiotics to give my gut a little bit of strength. And I also tried to get 8 hours of sleep, but truthfully, that was pretty much impossible with the interrupted sleeping, with the constant cramping and rushing to the toilet. I started to cut off my eating past 7 p.m. I made sure that my evening meals were lighter. My heavier meals were more or less during lunchtime. I tried eating breakfast, but again, I was always on a rush. I always had responsibilities that prevented me from eating proper breakfast. So I started to actually add in some snacks like fruits and crackers and peanut butter. So that slightly helped my overactive colon. I tried to be active. I've enjoyed activity throughout my life. One of the things I did constantly was ball hockey, played some badminton, loved cycling. So I try to incorporate that a little bit more in my day-to-day life. But again, the challenging part is that whenever I would have not a flare-up, but like that urge to go to the toilet, that prevented any long-term activities. I did go for small, short walks. That was helpful. We even got a treadmill downstairs in case I needed to rush to the toilet. That also kind of put me into a little bit more of an active role. My wife and we started to meal prep. There was a little bit more stress on her because she would have to make separate meals for myself and versus the family. A lot of my meals revolved around chicken, rice, vermicelli, rice noodles, anything that was soft foods. And then I took some precautionary stuff, like having second set of clothes. I had a second set of clothes at work. I had another set of clothes in my car in case I couldn't make it to the bathroom and I had some accidents. So those were mentally some exhausting things to think about, and worries and embarrassments that I was trying to avoid, which also resulted in lack of socializing. Stayed home a lot. started to go less and less to kane, just because you could hear my stomach when things were quiet. I couldn't sit on the ground as long because of the pressure and the pain that I was feeling. Strategically, I had to know where all the bathrooms were wherever I was. And that, again, was a severe mental challenge. I also adapted carrying a survival bag. You know, nowadays you see kids and adults even carrying bags, but I think I created that fashion sense way back when. And in my pouch, I had baby wipes. I would carry an extra pair of underwears. I'd carry some disposable bags, and at times, because my severe cramping would really put a lot of strain in not just mental but physical pain. I would have a small massage gun with me, so that I can kind of find some kind of relief. And then I went through going through all that. The final result was in the stage 2, where I had to do the surgery and went through a full colon removal. That gave me a lot of relief. I didn't realize how much pain I was in until I had my colon removed. I had new challenges that I ended up facing with the colon removal, because I had an ostomy pouch, which again was a new series of challenges that I had to go through. But at the end of the day, I had proper supervision. I had proper guidance, because now I had a new GI. I also seek external help dealing with my mental issues, and also opened up a circle of friends that I could trust around whenever we did any social activities, that I would be okay to exit whenever I needed to. The biggest thing that got me through a lot of this was the support of my family. Without that, I know I would have struggled even more, and I would have questioned a lot more why things were happening and not dealing with how I can get better. Thank you, Sadaf.
Thanks, Shafeen. We really appreciate you giving us this information. Lastly, what would your advice be to others in the community to support them in the management of their ulcerative colitis?
Well, Sadaf, I'm not an expert, and I don't want to assume everyone will have the same journey as I have. But 3 things that I would recommend to everyone that's listening is that, first, I started off with the IBS, and I took it very lightly. So any indication at first glance, or don't take it lightly. Learn and make changes early on in your lifestyle, such as learning about nutrition, getting ample of rest, meditation, incorporating activity, and managing the stress. This will go a long way for preventative measures. Don't take things lightheartedly. If I had started my fight earlier than 2013, when I got hospitalized and when I was quite worse, I believe that I would have had a better transition to where I am now. Secondly, seeking multiple professional opinions. As science continues to evolve, don't settle with the first answer you get, or accept the treatment that was first suggested. I was afraid to offend my GI by challenging him for alternate treatments during the early stages of my condition, and I wish I had pushed him harder. But I was fortunate that I was able to seek a second opinion that gave me more options and gave me time to understand my chronic disease and how to deal with it. And then thirdly, have a circle of people to support you in your journey. The support I got helped me to get through the challenges I faced and the stress levels that I had to go through. Lastly, I just want to leave a comment behind, is that don't let the disease take control over your life. Take control over the disease by learning, making lifestyle changes that best fits your needs, and having the circle of support. It is very, very important. The disease took over my life for many years, and now I'm still battling it, but I feel now stronger that I have control over my life, and I wish everyone the best.
Thanks, Shafeen, for sharing your story with us. It is most inspiring and great to hear how you have adjusted to living with this chronic disease. This brings us to the end of today's webinar. I would like to thank Dr. Farhad Peerani and Dr. Puneeta Tandon for the excellent information provided to us today, and to Shafeen Rajani for sharing his journey with us. Thank you for joining us today, and we kindly ask that you fill out an evaluation for this session. The feedback we receive allows us to determine whether these webinars are helpful and what topics you are interested in hearing about in the future. Finally, I would like to invite everyone to join us for future sessions in the Your Health is Your Wealth series, and visit iicanada.org to view previous webinars and learn more about 5 to Thrive. Thank you everyone for joining us today.